Hello and welcome back. Today we're going to discuss something hitting the news lines. Monkeypox. Is this the new COVID? Are we going to have to mask up again? Start social distancing? The answer is no. Very unlikely. However, the WHO, the World Health Organization, has declared it a new global health emergency. So a little discussion is necessary. This isn't the first time the public was alerted. Even recently. There was an outbreak in 2022. In fact, I remember getting a fax sitting at my desk from the health department that there was a few cases in Nevada. Subsequently, I got another fax a couple days later. The rate actually doubled. A little bit scary. However, this outbreak was self-limiting and it went away. However, you know what? We don't learn a lot about monkeypox in medical school. It's not a big topic. So a lot of us are now learning about it on our own, on the fly, reading articles, and just becoming familiar with the disease so we can help identify it. So what is monkeypox? It's a pox virus made of double-stranded DNA. It comes from the same family as smallpox. However, less fatal, thank God. This virus has been around for a while. Long time. However, the first documented case that was in humans was in 1970 in the Democratic Republic of Congo. At the same time, there was a global effort to eradicate smallpox, the more lethal, dangerous cousin of the disease we're talking about. On September 1st, 1970, a 9-month-old boy presented to the hospital with a high fever. Several days later, he broke out in a rash that covered his arms and his legs. It was also documented that the patient had swelling of his ears, face, and painful, enlarged lymph nodes around his neck. The monkeypox virus was isolated from the patient and from the skin scrapings of the lesions. He was treated and he recovered. However, before he was discharged, he developed measles and died. Now, between 1970s and the early 2000s, monkeypox in humans was exclusively an African disease. Outbreaks were isolated to Central and Western Africa. And in 2003, this all changed with the first reported cases outside of the continent. Now, like any illness, disease floating around, there is going to be stigma. Monkeypox is no different. The most recent outbreak in 2022 was seen throughout Europe. And there was some connection or correlation with men who had sex with men. However, it is important to understand that the disease is not sexually transmitted in that sense, and anyone is vulnerable to be infected. Infection happens in 3 stages. There's the incubation, there's the prodrome phase, and there's the eruptive phase. In the incubation phase, this is the time between being infected and when somebody starts to show symptoms. For this virus, it lasts anywhere from an average of about 13 days. Next is the prodrome phase or stage. And this is where the body starts to manifest and show signs of infection before the full-blown typical disease that people see. These symptoms are generally non-specific, and in monkeypox, they are high fever, headaches, fatigue, and enlarged lymph nodes, particularly around the cervical area and the chest. In the eruptive phase comes the characteristic rash, the skin lesions that appear. For patients who have these lesions, they tend to grow and change, but they typically look like pimples, and it covers the entire body. This may look similar to chickenpox. However, in chickenpox, there's no lymphadenopathy, no enlarged lymph nodes. And secondly, in chickenpox, there's no lesions, marks on the palms and soles of the feet. The severity of the disease can vary from person to person. However, children, pregnant women, and the immunocompromised are very susceptible and can show more severe signs of infection. Generally speaking, monkeypox is self-limiting. This is doctor speak for generally non-lethal, generally. However, some manifestations of monkeypox can cause facial scarring, skin scarring, and even in some cases, ulcerations of the eye. Because the disease affects the skin and it can leave openings in the skin, bacterial infections can happen after you break out with the skin rash. Again, death can occur, and in monkeypox, it can range anywhere between 6 to 15% depending on the strain of monkeypox and the severity of the disease in the individual. The disease is what we call zoonotic. What this means is it comes from animals. The specific animal has not actually been identified, but there are several animals who can be infected with monkeypox or spread it. Tree squirrels, rats, prairie dogs, monkeys. The disease is seen in many animals and definitely can spread to humans. Person-to-person transmission is generally through body fluids and skin-to-skin contact. Right, like I said before, it is not sexually transmitted in that sense. However, it can be found, or the virus can be isolated in sperm. There are authorized medications for monkeypox in the United States. There's 2 of them. They are extremely hard to get. They're going to be delivered by the Department of Health. I'll list the names above me. Also, monoclonal antibodies are being tested by the FDA, so this is another way to treat monkeypox. But again, I like to remind you that most cases are self-limiting. So, the only other important thing to say about monkeypox is that they did find that those who've been vaccinated for smallpox are semi-protected against monkeypox. However, the issue is now that people are not really vaccinated for smallpox. Remember, it has been eradicated. So that herd immunity that some people may have had is waning. So again, the best thing to do for patients now is just to be aware, to look for signs, and if you feel you have these symptoms, is to contact the Department of Health or your primary care physician. Essentially, just stay knowledgeable and be safe. Thank you, like and subscribe.